Welcome everyone. My name is Andy Saptono. I'm a faculty at the Health Informatics, and in this presentation I'm going to talk about Health Information Exchange Organization. The Health Information Exchange Organization is an organization to oversees and governs the exchange of health-related information among organizations according to nationally recognized standards. So once we have the capability to interoperable to exchange health informations, these are the place where this happens, the exchange happens. These are some of the terms that we use in the health information exchange organizations. Electronic medical records, or EMRs, are the building blocks that we use to build the health information exchange organizations. Personal health records are the building blocks that we use to build that for the individuals. The health information exchange is the enabler to enable the efficient communications. And then the regional health information organizations, or the RHIO, is the one that organizes these components into a local infrastructure. There are three types of HIO, health information organizations, in the United States. The first one is a centralized, where the organization will centralize all the patient data and store in a centralized repository, data warehouse, or other database. The health information organizations has full control over the data, including the ability to authenticate, authorize, and record transactions among participants. So all the healthcare providers and participants send the data to this centralized location, and the organizations authorize who can access what. The federated, the second type of the HIO architecture, is an interconnected but independent databases that allows for data sharing and exchange and grant user access to information only when needed. So it is not centralized. If I want to ask for information from another, then I have to go to a network. I have to ask properly for an access, and the network will grant the user access to whoever is asking for that information. And then there's the third one, which incorporates both sides of the federated and centralized to harness the advantage of both. So there is a centralized location where data are stored, but there is also a possibility to directly ask informations in between the independent databases. The data being exchanged in the health information organizations typically are the clinical data, claims, pharmacy data, public health data, as well as quality reporting and other types of report data. Now, the benefits of being involved or being part of the health information organizations, well, it will allow us a care coordination because we are able to exchange information within the network, which means that if the person moves throughout the network, we can coordinate the care. We can easily find a patient's informations because there is a record locator service. Exchange of data, aggregation of data, as well as potential to provide a new care delivery methods. Historically, HIO have started all the way from 1990, but this is still in a very, very preliminary version in 7 communities. So it is a pilot project, and it is not a large one, but at 1990, this program, the Community Health Information Management System, is considered as the first organized attempt to share health data. And now, with the advancement of the internet technology, from 2004 all the way to present, standards are being developed to ensure a capability of exchanging information between health organizations, as well as the policy that supports and promote, as well as mandate those health information exchange. The larger system that covers not only the regional is what we call the e-health exchange. Formerly, this is called the Nationwide Health Information Network, or NWHIN. This is a group of federal agencies and non-federal organizations that come together to streamline this health information exchange. So right now it is called the e-health exchange, and the organizations that support the e-health exchange is called the Health E-Way. So this is the non-profit, public and private collaborative that operationally supports the e-health exchange. So this is the health information exchange organizations at the national level. When talking about the health information exchange, we sometimes also heard about the health information service provider. These are the organizations that support the secure transport of health information. So these are the organizations that ensures that the data being exchanged are secure. Some health information organizations have their own health information service provider. Some others have utilized a third-party HISP. Talking about the privacy and security, always considering about the HIPAA, and all that HIPAA mandates in an exchange also applicable to health information organizations. So the health information organization need to set up policies to follow what is mandated in HIPAA. As an example of HIO workflows, an example is a secure messaging between providers. So as an HIO, the healthcare providers within that HIO can use the HIO as a communications platform. So they can communicate, talk about the patient's treatment, ensuring that the patients have the best care that they can achieve from that network. So these are some of the sample HIO workflows that are very, very common in the healthcare. And the idea is that with an exchange of information, the patient's treatment can be coordinated and they can be given the best treatment possible from all the potential providers within the network. That is all that I would like to talk about the health information exchange organizations. Hopefully it will help you understand more about health information organizations in the United States. Thank you very much.